The nationwide vaccination effort is under fire as more hospitals across the country reach a breaking point. Nationwide, more than 128,000 Americans are hospitalized, with more than 23,000 being treated in intensive care units. Some hospitals in California are being forced to treat patients in tents. Others have had to turn some patients away. This as millions of vaccine doses are shipping across the country, but not finding their way into the arms of most Americans. Since the first dose was administered in mid-December, just over 4 million Americans have received their first vaccination. That is far less than the 20 million people the Trump administration had promised by the end of 2020. On Monday, thousands of Texas residents spent hours on long lines to get a shot. Many counties across the state are now reporting they have run out of the vaccine. This all comes as health officials report a man living in New York has been diagnosed with the new variant of the virus, initially found in the UK. The man had no recent history of travel, and there are questions about how he contracted it. With his diagnosis, New York becomes the fourth state to confirm a case of the new strain. John Moore is a professor of microbiology and immunology at Weill Cornell Medical College at Cornell University, and he joins me now. Professor Moore, welcome. Great to have you with us. So there are currently 4 states reporting this mutated strain of COVID-19 across the country. In Southern California, hospitals are at max capacity. And as of Monday, emergency medical services have been directed to conserve oxygen and not transport patients who go into cardiac arrest unless circulation can be restored on the scene. You know, hearing this, it's not something you'd expect to ever see happen in the United States. So with this new variant strain, how much worse can we expect things to get?
Well, what do we know? Firstly, it's going to be fairly widespread. We don't test in America very well for genetic sequence variants. The Brits are very good at this. It's one of the few things they've done particularly well during this pandemic, but most of the rest of the world is lagging behind. So the chances are high this virus, this variant, is more widespread than just 4 cases. We know that it's more transmissible. We also know that it's not more dangerous to an individual who's contracted it, and we know that it doesn't have any implications for the efficacy of vaccines. We're pretty sure about that, but studies are still ongoing. So people need to continue to practice mask wearing and social distancing. The new variant can't jump up and instantly pass through masks. It's just as blockable. It doesn't jump it doesn't jump 12 feet between people. It's preventable by exactly the same methods as in the past.
And so, Professor, we are also hearing reports of an even newer variant, or who knows how long it's been there, but it's being discovered in South Africa that some researchers are saying perhaps won't respond as well to the vaccine. What do we know about this particular variant?
Well, we know less, but evidence is emerging that it is more transmissible. It's speculated, based on modeling, that it could be a problem for vaccines, but we really do not know that. These studies are being done in South Africa and being mimicked all around the world in multiple different labs, and I'm sure that an answer to the vaccine efficacy issue will come in the next week or 2. So we don't know it, but there are more grounds for concern than there are with the British UK B117 variant.
Because there is less known about it. How concerned should we be about variants in general? It seems in our global world, once a variant pops up somewhere, it seems highly inevitable that it will pop up somewhere else. Isn't that correct?
That's correct. I mean, if it's more transmissible, given that there are still communications, travel between countries, viruses will spread. And viruses mutate. I mean, in some ways, we're lucky with the coronavirus, is that it's less prone to mutation than other viruses that also have RNA as the genetic material. But you put it in hundreds of millions of people over the course of a year, and it will evolve. And it evolves to be more transmissible. That's what viruses do. So it's not a surprise that new variants are popping up and are being detected by surveillance programs. And we can expect this. We just have to hope that it doesn't evolve to be more dangerous to an individual who's infected, which is not being seen yet, and that it retains the sensitivity to the current generation of vaccines, and that no retailoring of vaccines is going to be necessary, because that would be a significant delay to effective vaccine rollout.
Sure, that would be a setback. Now, in the UK, this new variant is causing lots of problems. Obviously, British Prime Minister Boris Johnson is saying this new strain appears to be 50 to 70% more transmissible. And as of Monday, the UK entered its third nationwide lockdown. Now, as you know, the U.S. has a higher case total than anywhere in the world. And as you mentioned earlier, the Brits have a good way of determining this variant strain. It's probably here, too, on a wider level. So when you take all that together, and as more coronavirus cases are reported across the U.S., do you think our leaders should be discussing a nationwide lockdown as well?
I think it's unlikely to happen here. It's just politically toxic, and even for the Biden administration, it won't happen under the remaining days of what's left of the Trump administration. All these things need to be discussed seriously and openly in case they do become necessary. I mean, a more transmissible variant is a problem. I mean, it will spread, because if the original virus is spread, so will a new one. And if it's more transmissible, the number is ever changing. I've heard anything from 20 to 70% more transmissible. We don't have a really hard figure on it. But it's clearly not a good thing to have a more transmissible virus moving around, and we may have to respond to it. And
Professor, more quickly before we let you go, are you discouraged at the rate in which the vaccine is being distributed? I mean, for instance, I have a father who's 75 years old, and he's in that group of first, people who are supposed to be receiving it first. He hasn't heard anything from his healthcare provider. Many other people are in the same position. Is it discouraging you, or do you feel that you're still hopeful enough about the way the vaccine is getting out there?
Well, it will get better over time, but it's not done well so far. There's no question there's been a problem, and the problems seem mostly located in once the vaccine shipments have reached airports and railway stations, mass communication hubs. It's not getting efficiently to the hospitals, and the hospitals are overworked and understaffed for trained personnel. It's not trivial to just stick a needle in someone's arm. The doses have to be measured out carefully by trained staff under defined conditions. And it's all underfunded. I mean, the states are underfunded. The federal government has dumped all responsibility on the states, but is not funding them to do the work that's necessary. And there's a really sad communication gap between the Trump administration programs in this area and the incoming Biden team. The communication is not happening, and it's purely political, and it's disgraceful and needs to be changed by public pressure, because we need the new team to come in fully prepared to deal with, and if necessary, modify what is presently happening at an inadequate level.
Professor John Moore, thank you so much for joining us. We really appreciate your time.
Thank you.